Up to 84% of postmenopausal women will experience a condition so severe. I mean, it literally physically degrades their tissue.
Yeah, it's brutal.
It makes simple daily movements uncomfortable, and intimacy is just, absolutely agonizing. And yet, for millions of women tuning into this deep dive, the absolute gold standard cure is just completely off limits.
Which is incredibly frustrating.
Right. So today we're looking at a massive stack of clinical studies, medical reviews, and some really fascinating aesthetic gynecology research. And we're focusing on a massive issue, genitourinary syndrome of menopause, or GSM.
And, it's an overwhelming statistic. 84% is huge. And the reality of GSM is just far beyond mild discomfort.
Right. It's not just dryness.
Exactly. We're talking about profound vaginal atrophy, extreme dryness, a drastically thinning mucosa, and dyspareunia, which is painful intercourse.
And don't forget the urinary stuff.
Right. Add to that debilitating lower urinary tract symptoms, and you really have a condition that just shatters a person's quality of life. Now, the traditional treatment is straightforward, right? You apply local estrogen, the tissue absorbs it, and the cells wake up.
But our sources highlight a really massive gap in that care plan. I mean, what if you are a breast cancer survivor?
Exactly.
Or what if you have an estrogen-sensitive condition? Or, what if you're dealing with severe refractory GSM? And by refractory, we mean the tissue is so damaged it's essentially gone rogue and just, it stops responding to hormones altogether.
Yeah, the hormones just stop working.
And if you can't use estrogen, you're usually just handed a temporary moisturizer and told, well, this is just a normal part of aging, deal with it.
Which is incredibly dismissive and honestly scientifically outdated.
Oh, absolutely.
And that brings us to our specific mission for today's deep dive. We are unpacking a revolutionary, completely non-hormonal regenerative therapy. We're going to explore the biological mechanics of how something called an exosome can accelerate sub-mucosal re-epithelialization.
Which is a mouthful.
It really is.
Yeah.
But simply put, we're looking at exactly how this therapy physically repairs and regenerates tissue in severe refractory GSM. And it does it without a single drop of added estrogen.
Okay, so before we can map out how this actually rebuilds a thinning vaginal wall, we really have to look at what the therapy is. And I guess maybe more importantly, what it isn't, right?
Right. Very important distinction.
Because when people hear regenerative medicine, I mean, the mind immediately goes to stem cell therapy.
It does, yeah.
Like injecting live cells into a damaged area. But these sources are making a very sharp distinction here. Exosomes are an entirely different game.
They are completely different. I mean, first off, exosomes are not cells.
Wait, they aren't?
No, not at all. They are microscopic, membrane-bound extracellular vesicles. They are incredibly tiny. We're talking typically 30 to 150 nanometers in diameter.
Wow.
Yeah, which makes them roughly like 1,000th the size of a human hair. And because they operate at that nanoscale, they can slip through spaces in our tissue that large live cells could literally never access.
Okay, and they're being secreted by almost all the cell types in the body, right? I mean, the sources mentioned mesenchymal stem cells from umbilical cords, adipose or fat tissue, and bone marrow.
Exactly.
But the really crucial detail here is that the exosome itself is not alive. Like, it has no nucleus. It can't divide. It can't mutate.
That's right. It is essentially an ultra-secure biological care package. Picture a lipid bilayer, so an outer shell made of fats.
Like a microscopic bubble wrap?
Yes, exactly like fatty bubble wrap. And it protects the internal payload from being immediately degraded by the highly acidic, enzyme-rich environment of the body.
Sure.
And that internal payload is where the magic actually happens.
Right, the cargo.
Yeah, it's a highly concentrated cargo of growth factors, lipids, signaling proteins, and very specific microRNAs.
And the sources actually named a few of those microRNAs. I think it was Mir 146A 5P and Mir 21 5P.
Good memory. Yeah.
But those aren't just, random genetic alphabet soup. Those are highly specific commands.
Very specific.
Like, one of them tells a cell to stop producing inflammation, while another specifically orders the creation of new blood vessels. So tell me if this analogy works. If traditional stem cell therapy is like dropping a massive crew of live construction workers into a damaged neighborhood to build new houses, then exosomes are like sending a fleet of secure encrypted text messages directly to the local workers who already live in that neighborhood, giving them the exact blueprints to rebuild the houses themselves.
That is a perfect analogy.
Yeah.
Because you avoid the massive risks of bringing in foreign workers. I mean, live stem cells can get lost, right? They can trigger a huge immune reaction, or they can even start growing into the wrong type of tissue.
Which is terrifying.
It is. But with exosomes, You are just delivering the precise biological instructions needed to get the patient's own dormant cellular crew back on the job.
Okay, but wait, I've got a pushback here.
Okay, let's hear it.
How does a chemical message build physical tissue in a completely atrophied environment? I mean, in severe GSM, the local cells are essentially starved, right? They're shut down. A text message doesn't physically lay down bricks. So how do we actually get from a tiny, fat bubble of instructions to real thickened vaginal mucosa?
That happens through a biological mechanism called cell-free paracrine signaling. The exosome doesn't need to do the heavy lifting itself. It just needs to provide the molecular keys to turn on the machinery inside the patient's dormant cells.
Okay.
And in the vaginal mucosa, the key players are fibroblasts. Those are the cells responsible for making structural proteins.
Yeah.
But in a patient with GSM, the lack of estrogen has caused these fibroblasts to go completely dormant. They are effectively asleep on the job.
So they're there, they're just not doing anything. And then an exosome slips its protected cargo right into that sleeping fibroblast.
Exactly. The microRNAs enter the fibroblast, interact directly with the cell's own DNA machinery, and forcibly switch that dormant cell back into active repair mode.
Oh, wow.
Yeah, the fibroblast suddenly wakes up and just starts producing the raw materials needed for structural repair.
Which takes us right into the actual construction process. The medical term the sources use is that sub-mucosal re-epithelialization we mentioned earlier, basically just rebuilding the wall.
Reholding the wall, exactly.
And the first thing that has to happen is filling in the gaps. The exosomes target vaginal keratinocytes, which are the specific cells that form the physical protective barrier of the vaginal wall.
Right, the outermost layer.
Yeah, and the chemical signals tell these keratinocytes to proliferate and migrate, to multiply and spread out to thicken the thinned areas of the mucosa.
But, building a thicker wall introduces a completely different problem. You can't just stack up new, highly active cells without feeding them.
Because they'll just die off again.
Exactly. Tissue survival relies on a constant, steady supply of oxygen and nutrients.
So if you don't build the plumbing, the new house is unlivable.
Precisely. Which is where angiogenesis comes in. Exosomes transfer pro-angiogenic factors, most notably vascular endothelial growth factor, or VEGF.
Right, VEGF.
This specific protein is delivered directly to local endothelial cells, stimulating them to branch out and form brand new blood vessels. And the studies in our stack actually verified this by tracking the CD31 marker.
And that's how they know it's working.
Yes. When CD31 lights up under a microscope, it is absolute proof that new capillary networks are being actively formed in the tissue.
Okay, so the tissue is getting thicker, and it's getting this massive new blood supply to keep it alive. But the structural integrity of that tissue is what really caught my eye in the sources.
Oh, the collagen numbers.
Yeah. They pulled clinical observations from aesthetic gynecology, where exosomes have been used for skin rejuvenation. And they noted that after exosome therapy, collagen synthesis can increase by up to 690%.
It's unbelievable.
And elastin production goes up by up to 300%.
It really reveals the sheer potency of that nanoscale payload. I mean, a 690% increase isn't just a subtle nudge to the local cells.
No, it's an explosion.
It is a massive systemic upregulation of the exact structural proteins that give vaginal tissue its elasticity, its stretch, and its youthful thickness.
Well, let me ask you about the reality of severe GSM here. Because the tissue isn't just thin, right? It's locked in a state of continuous breakdown.
Right.
The body is starved of estrogen, so it is actively dismantling its own infrastructure. If you pump out 690% more collagen into an environment that is actively destroying collagen, isn't that just like pouring water into a bucket with a massive hole in it? I mean, the body is just going to tear that new tissue right back down, isn't it?
That is the exact hurdle that makes treating refractory GSM so incredibly difficult.
Okay.
And it's why applying like a standard growth factor serum usually just fails completely.
So how do exosomes bypass that?
Exosomes don't just build the new tissue. They actively protect it by remodeling the extracellular matrix, the ECM. You see, our bodies naturally produce enzymes called matrix metalloproteinases, or MMPs.
Right.
In a healthy body, MMPs just clear away old, dead tissue. But in an atrophic state like GSM, these MMPs go into massive overdrive. They act as a rogue demolition crew, constantly breaking down the extracellular matrix and shredding whatever collagen is left.
So they are the hole in the bucket.
Exactly. But the exosomes carry specific microRNAs designed to downregulate those rogue MMPs. The instructions effectively fired the demolition crew.
That's amazing.
Yeah, so by halting the breakdown of the matrix, the exosomes allow that massive surge in collagen to actually take root stick around, and provide lasting structural support and hydration.
So the blueprints are delivered, the keratinocytes build the barrier, VEGF lays the plumbing, and the exosomes fire the demolition crew so the collagen can actually hold.
Got it.
But, anyone listening who has actually suffered from severe GSM knows that thin tissue is really only half the nightmare. The other half is the burning.
Yeah.
The constant agonizing irritation.
The inflammation.
Right. The vaginal environment becomes highly inflammatory and hostile. And if the tissue is essentially on fire, surely the new cells won't survive long enough to actually heal the mucosa.
Addressing that inflammation is arguably the most critical function of these specific exosomes. They arrive with powerful anti-inflammatory and antioxidant effects.
So they put out the fire.
Literally. The sources detail how the lipid payload shields the recipient mucosal cells against oxidative stress. They actively hunt down and suppress pro-inflammatory cytokines.
Like the chemical fire alarms.
Exactly. Cytokines like IL-6 and TNF-alpha are essentially the fire alarms of the immune system, constantly keeping the tissue in a state of red alert. The exosomes silence those alarms and simultaneously ramp up the production of soothing anti-inflammatory mediators like IL-10.
Okay, so trying to heal severe GSM without exosomes is like trying to rebuild a wooden house while an angry mob is actively throwing matches at it.
That's a great way to picture it.
The exosomes don't just supply the wood for the new house, they act as a massive fire extinguisher, putting out the flames so the foundation can actually set properly.
And to take that fire extinguisher concept one step further, the exosomes actually change the minds of the people throwing the matches.
Wait, really? How?
The sources highlight a really fascinating mechanism called macrophage polarization. So macrophages are a type of white blood cell that patrols our tissue.
Like security guards.
Right. But in severe GSM, these macrophages are stuck in what's known as the M1 phenotype. M1 is a highly aggressive, pro-inflammatory attack mode. They're trying to clear away damaged cells, but without estrogen to regulate them, they go completely overboard and just start attacking the healthy tissue too.
So the immune system gets stuck in this feedback loop of destruction.
Exactly. But the exosomes arrive carrying signals that physically force these macrophages to flip from the M1 phenotype to the M2 phenotype.
And M2 is different.
Very different.
Right.
M2 is the reparative tissue healing mode, so the macrophages drop the matches and actually start helping with the construction. The exosomes literally reprogram the local immune environment from destroy to heal.
That is just, that's hacking the immune system at the most fundamental level.
Yeah.
The biological theory here is incredibly sound. We have cell-free paracrine signaling, blood vessel creation, ECM protection, and an immune system flip.
All working together.
Right, but biological theory in a petri dish doesn't always translate to the messy reality of the human body. Our sources dive into physical models of severe urogenital damage, and it looks like the first massive hurdle they had to solve wasn't even cellular, it was just gravity.
Yes. The delivery problem. The vaginal canal is a highly dynamic, self-cleaning environment.
It naturally flushes things out.
Exactly. If a doctor simply injects a liquid suspension of exosomes, the liquid will naturally disperse, leak, or just wash away before those nanoscale fat bubbles ever have time to penetrate the tissue and deliver their payload to the dormant fibroblasts.
So you need the blueprints to stay exactly where the damage is for days, not minutes.
Right. To solve this, researchers turned to bioengineered carriers. Specifically, they started loading the exosomes into a hyaluronic acid hydrogel.
Like the stuff in skincare.
Same basic molecule, yeah. Hyaluronic acid is naturally occurring, highly biocompatible, and very thick. So this hydrogel acts like a physical scaffold. It adheres to the vaginal wall, holding the exosomes directly against the submucosa.
Oh, that makes sense.
And over the course of days and weeks, the hydrogel slowly dissolves, providing this localized, sustained, slow drip release of the signaling payload right into the damaged tissue.
And the sources looked at what happens when you use this hydrogel delivery system in an overreactomized rat model, which for listeners in preclinical research, removing the ovaries of a rat is basically the standard way to crash their estrogen levels and simulate human menopause.
Right, it creates that severe atrophic state.
So when they applied these exosome-loaded hydrogels to the severely atrophied vaginas of these rats, the tissue just lit up with a marker called Ki-67.
Which is huge. Ki-67 is a definitive protein marker for cellular proliferation. It only appears when a cell is actively dividing and multiplying.
So it proves it wasn't just swelling from the gel.
Exactly. Its presence proved that the thickening of the vaginal wall wasn't just temporary fluid retention. The tissue was physically growing new, dense, healthy cell layers. And crucially, it did this without triggering any abnormal cellular mutations, which is always a major safety concern when you command cells to rapidly multiply.
That's reassuring. But the research didn't stop at just simulating menopause. They took this into a pig vaginal mesh model. And this is where the true regenerative power really gets tested, right? Because vaginal mesh complications represent some of the most traumatic, difficult to heal injuries in all of gynecology.
They absolutely do. Vaginal mesh implants often trigger a massive foreign body response. The tissue is placed under extreme mechanical stress. You have chronic inflammation and heavy scarring.
It's just a nightmare environment.
It is a totally hostile, constantly irritated environment that heavily resists normal surgical healing.
And in this severe injury pig model, exposing the damaged tissue to exosomes triggered de novo tissue regeneration, meaning the tissue didn't just scar over, it grew brand new functional mucosa right over the exposed mesh.
It's incredible.
The specific measurement in this source is staggering. The pigs that received traditional surgical closure managed to grow a flimsy epithelial layer about 80 micrometers thick.
Right.
But the pigs treated with exosomes grew a dense, healthy mucosal layer 208 micrometers thick.
It is nearly triple the structural integrity in an environment that actively resists healing. And alongside that thickness, the capillary density and network of new blood vessels we talked about earlier was vastly superior.
And the inflammation.
The markers for chronic inflammation and fibrotic scarring were practically non-existent compared to the surgery-only group.
Okay, but let's pause here and look at this from the perspective of someone listening to you right now who is suffering.
Of course.
We are talking about microscopic measurements of rat and pig tissue. How does a pig's cellular response to a vaginal mesh injury translate to a human woman dealing with the agony of refractory GSM? I mean, why should she feel hopeful about this?
That skepticism is completely warranted because the leap from animal models to human clinical reality is where a lot of treatments fail.
Right.
However, the specific biological pathways activated by exosomes like VEGF signaling for blood vessels or fibroblast activation for collagen synthesis, those are fundamentally conserved across all mammalian species.
So it works the same way?
Yes. The molecular language an exosome uses to tell a pig's fibroblast to start making collagen is the exact same language it uses to tell a human's fibroblast to do the exact same thing.
The genetic blueprints just don't change.
They don't. And furthermore, we are already seeing this language at work in human clinics. The sources point to early clinical evidence using adipose-derived tissue products.
So from fat tissue.
Yes, products rich in mesenchymal stem cell exosomes derived from fat tissue. Clinicians treating human patients with severe GSM are reporting really dramatic, measurable symptom improvements. Patients are experiencing restored natural lubrication, significant reductions in dyspareunia, and improved structural support that even aids with urinary continence.
And the timeline of that relief is what truly separates this from, like, a temporary palliative cream. The sources indicate these improvements are lasting 2 to 3 years from a single treatment course.
Because you aren't just masking friction anymore. You are fundamentally remodeling the tissue architecture back to a premenopausal state. You are treating the disease at the level of cellular senescence.
Which is what, exactly?
Senescence is the state where aging cells stop dividing but refuse to die. They just sit there causing inflammation. Exosomes clear out that senescent environment and completely rebuild it.
So what does this mean for you, the listener? If you have been battling refractory GSM, or if your medical history means estrogen is off the table, this research is a profound validation of your pain. Your tissue isn't just aging or broken beyond repair.
No, it's not.
It is simply dormant. The construction crew is still there. They just lost their blueprints when the estrogen faded.
This represents a monumental paradigm shift in women's health. We are moving away from lifelong symptom management. Hormonal therapies require continuous, unending use to maintain the tissue, and they carry systemic risks.
Right.
But exosome therapy targets the actual root cause of the atrophy locally. By physically thickening the mucosa and restoring its elasticity, you also naturally restore the acidic pH of the vaginal environment.
Which brings back the local microbiome defenses. The sources explicitly note that this structural repair drastically cuts down on the recurrent urinary tract infections that plague so many GSM patients. It is just a holistic, localized restoration.
It's a masterclass in the body's innate ability to heal itself when it is provided with the correct, highly targeted instructions.
Okay, so to recap how we got here, we moved past the idea of live stem cells and looked closely at exosomes as ultra-secure nanoscale text messages.
Right.
We saw how they use cell-free paracrine signaling to wake up dormant fibroblasts. We watched them build a new physical barrier, lay down intricate new blood vessels with VEGF, and pump out massive amounts of collagen while actively firing the destructive MMP demolition crew.
Exactly.
And perhaps most importantly, we saw them act as a fire extinguisher, flipping angry white blood cells from a state of destruction into a state of rapid healing, physically thickening the vaginal mucosa in even the most severe injury models.
It is regenerative medicine in its absolute purest form. But, diving deep into the mechanisms in these sources revealed one final, truly mind-expanding concept about what the future holds for this therapy.
Oh, wait, lay it on me.
So, the sources detail that certain exosomes, specifically those derived from adipose tissue, can actually stimulate local estrogen production.
Wait, what?
Yeah, they do this by expressing an enzyme called aromatase. Now, aromatase has a very specific job. It converts existing androgens in the body into estradiol.
Okay.
And the exosome forces this conversion to happen right inside the local vaginal tissue without the estradiol ever entering the patient's systemic bloodstream.
Wait, the exosomes are giving the local tissue the blueprints to manufacture its own private supply of hormones.
They are turning the tissue into a localized producer. So the really provocative thought here is this. If exosomes can naturally be programmed to force local tissue to produce its own hormones, could we eventually engineer smart exosomes that act as microscopic, cell-free hormone factories?
Oh, wow.
Imagine a near future where we don't just use exosomes to physically rebuild the tissue structure, but we use them to permanently cure menopause-related decline in specific targeted organs.
So no more pills.
Exactly. A woman could restore the hormonal balance of her genitourinary system perfectly without ever having to take a single systemic hormone pill.
A microscopic localized hormone factory. I mean, that wouldn't just change the treatment of severe GSM. That would completely rewrite the entire rulebook for menopause care forever.
It opens up a future where tissue decline is entirely reversible.
It is so easy to look at a diagnosis like severe refractory GSM and feel like you are just staring at a brick wall. The tissue is damaged, the gold standard treatments are off the table, and the daily reality is incredibly painful.
It's hard.
It is. But peering into the nanoscale, looking at the sheer biological power of these tiny lipid-bound messengers, it proves that the body hasn't forgotten how to heal. It just needs the right text message to wake back up. Thank you so much for joining us on this deep dive into the future of regenerative medicine. Stay curious, keep asking the hard questions, and we'll see you next time.